Hello, everybody, and welcome to our special PCOS edition of Thursday's Office Hours with Nurse Linda.
Hello, welcome, guys. I'm so glad. Well, it's so sad that we have to have a PCOS month, huh? But we do, and it's September. So how can we have a webinar and not talk about the most hated topic, but yet the most sought after for info topic? When I mentioned it to Terry, it took off. So, and I know a lot of people, I think it's like 1 in 10 technically have PCOS, but I know a lot of you wonder if you have it. So not only do I have the people who have been truly diagnosed with it like me, but we have all of you guys who think that you might be impacted by it. So that's why it always gets a lot of interest. So it is so cool now because as time has gone on with Ask an Expert, we've kind of made it like I'm the only one who's really working it. So I'm pretty much, I hope you like what I say, because I'm pretty much the only one that's over there answering questions, but I'm getting back regular people. They keep coming back and we've got like little friendships going, and it's so cool. So if any of my regular people are coming to this webinar, please say hi. Give me a shout out, because I'm just loving talking to you guys, and I'm like really become addicted to it as well. Like I want to know how you guys are doing. I'm learning about you. So it's so cool to have that. And if you haven't been over there, it's not a big group thing. It's not a thing where everybody's reading your question and everybody gets to it's just you and I. You ask whatever you want privately, and I'm the only one who sees it, and I answer. And generically, we might put answers in our library so everybody else can learn. But I mean, that one-on-one thing, that's how it is over there. So if we don't hit you up over here, please feel free to come on over there and get your questions answered as well. Like I said, I'm OCD, so I'm answering them every day, all day. You don't have to wait long, that's for sure. But, the memberships are awesome. The silver one is, I don't even know exactly what the amount is, but I know you get a free ovulation HCG kit. So the darn thing is like $5 for 3 months. That's just crazy. So, do what you can, because there's a lot of info. There's so much info we give you guys over on YouTube. We've loaded up a bunch of videos as well. Go over there and like us and subscribe so you don't miss out. We're just trying to put a bunch of content out there for you guys. Anyway, should we get started, Ted?
Yeah, let's go.
Let's go. So, I thought I would try to be efficient here. And you guys know I talk about my stuff, my personal stuff all the time and what I've been through. So I thought, you know what, I'll take a few minutes now and I'm just going to give a really quick down and dirty of what I went through. Awesome. How I got diagnosed for PCOS and all that as well. So that way I get that out there and I don't have to keep piecemealing it. Yeah. Okay. Yeah. So on a birth control pill for a long, long time. And of course, everything looks beautiful and wonderful while you're on a birth control pill. After I got married, I went off the pill. And all those regular periods that came so nicely when you're on the pill just disappeared. I had no idea I was PCOS. I had no idea what that meant. Eventually, I did get pregnant on my own, so not even planning or trying. And I had my daughter, who is now pregnant thanks to Premom with her third baby. So when it was time to want to have the second one, after a couple of years like you do, well, I had put on weight in pregnancy. And of course, PCOS, we know what the weight is about that. So put on weight, and then periods that were just annoyingly irregular were gone after when I decided to try to have a second one. But I was also probably about a good 30 or 40 pounds heavier, periods just gone. So I went to a reproductive endocrinologist because I knew there was nothing I could do. Ovulation kits were just starting to come out, and this was the early 90s. And they were like $5 in a box. What was somebody like me going to do who has a period every 3 months? Spend $1 million on it? It wasn't going to work. So I didn't really know what to do. So I went to a doctor who basically said, tell you what, and he wrote out what looked like a prescription for me. And on it was Weight Watchers. I thought I was going to die. Are you kidding me? Yeah, I know I need to lose weight. Okay. That's not what I came to hear from you. So I left him. And that's when I decided to go to nursing school. And while I was in nursing school, I went ahead and pursued other treatments to try to get pregnant. Like, let me find a doctor who doesn't tell me I have to lose weight. And sure enough, there are plenty that will do that. And they started me out on the whole Clomid routine. PCOS, often you don't respond. I went up on the doses, never responded to Clomid. So they went, all right, Linda, well, you're not, back then Letrozole wasn't out. The next step up from Clomid is injectable fertility drugs with like an IUI. I said, okay, that's fine with me. So we did the injectable fertility drugs, but because PCOS people tend to hyper respond, right? Didn't respond at all to Clomid, hyper responded to the fertility drugs, like all those little baby follicles that sit on your ovaries when you're PCOS, they all grow. And there's no way they can do an insemination because they'll trigger all of those eggs to ovulate at once. And I'll be like the Octomom. So IUIs were always canceled. They didn't work. So then eventually I went to IVF. I did 2 IVFs. I did hyperstimulate, but you can't get too pregnant in IVF because they put back only a certain number of embryos. Neither one of my IVFs worked. So I said, okay, I'm destined to have one child in life, and there's that. So I finished nursing school. Takes me like 10 years, and I lost the baby weight. And what happened when I lost weight? I'm going to say if I get under like 150, my periods come back. Not like beautifully like some of your guys' charts look, but listen, they're every, I don't know, 60 days, at least I can try. And so the bottom line is for me, my PCOS indeed was very weight related. So I did end up getting pregnant. I literally on my own. Without really trying, I got pregnant and I miscarried at about 11 weeks. Devastated. I'm almost at the end of the first trimester. And I was bit by the bug because I wasn't expecting to get pregnant. And I decided to go back to the IVF clinic and said, all right, now, I'm not going to have a period to get started on this. So give me the Provera so I can have a bleed and get started on the IVF. She said, no problem. She said, but, we'll do a pregnancy test real quick. Make sure you're not pregnant. I'm like, yeah, sure. And they did. And I wasn't. And I said to her, I remember like, what if I got pregnant in the last week? And of course, everybody just went, pshaw, you didn't get pregnant in the last week. So I took the Provera. And I always have a bleed off the Provera. I didn't have a bleed. That kind of freaked me out. After about 10 days, my boobs started to hurt. They only usually hurt when I get pregnant. And I did a home pregnancy test. And sure enough, I was pregnant again right after the miscarriage. I don't know when I ovulated because I don't really have periods regularly. And I freaked out because I took Provera, which doesn't hurt anything. That's just progesterone. And now that daughter is 24 years old. Then as I got older, when I say older, like closer to 40 and in my early 40s, as hormones tend to start to calm down, the PCOS tended to calm down. And again, I started to get periods back. And at the ripe age of 44, I got pregnant naturally and had my last baby at 45. So that's my story. That's my down and dirty quick story about PCOS. So now you guys know about me. So I might pepper some of that through. But anyway, let's start answering questions. Okay. First question is, what are my chances of getting pregnant being that I'm 35 and have PCOS? Keep in mind, when you have PCOS, there's nothing wrong with your body in carrying a pregnancy, and there's nothing wrong with your eggs. So you can be PCOS and have a period every 42 days or 60 days. Well, that's okay because at least you can still make an effort and try. The downside on PCOS is that usually we don't have as much opportunity to get pregnant as you gals who are having a period every month. So that will decrease things a little bit. You just don't have as much opportunity. But again, the PCOS in and of itself isn't something that would decrease your fertility. It's just that it does tend to spread out the ovulation, and that makes it more difficult to get pregnant. All right, why is Letrozole preferred over Clomid for ovulation induction? Well, definitely for PCOS, Letrozole is preferred, or Femara, it's called as the brand name. Without getting in too much detail, Clomid lowers your estrogen to try to raise your FSH, or your follicle stimulating hormone level. Lowering that estrogen is not, that's why if you've ever heard, like, don't be on Clomid for more than 3 months in a row, because it starts to have some bad side effects by lowering your estrogen. That's not a good thing, but it is the mechanism by which it works. Letrozole has an altogether different mechanism. It doesn't have any of those negative side effects, and it tends to work better with PCOS people. So if you're somebody who's thinking about what my next steps are, Letrozole is probably going to be it. which leads me to the question, how to get pregnant with PCOS ? So again, depending on how your periods are, if your periods are regularly irregular, well, you can do the LH test kits. It's going to take a little bit more work and effort and time on your part, but you certainly can. And if you're having periods, that means you are ovulating. So just figure out when your ovulation is, be dedicated to it, and have sex like, we're supposed to when we ovulate. And that can be it. If you find you're more like me and you really don't have those periods very regularly and you need help, then you need to go see the doc about Letrozole. Prior to the doc, is there something you can do? Well, again, I can tell you, me losing weight, even though that was what I thought was the worst advice, was actually the best advice. Every time I lost enough weight and got my ovulation back, I got pregnant. He was right. I didn't like it, but he was right. There are over-the-counter supplements like inositol. Inositol is something that, because PCOS tends to have blood sugar issues or insulin-resistant issues, inositol is thought to help with that. It may or may not, do anything to really help you. I still take it. A prescription supplement called metformin, which is a blood sugar oral medication. Sometimes women take those and it does actually bring their period/ovulation back. But if you were, again, like me, where you weren't having periods, then you have really no choice but to go to a physician to get assistance, either get prescribed medications or what have you, to try to get pregnant.
Little insert here. Sorry.
What, honey?
We did actually just put a blog out about this topic too. If you want to go deeper, it's called 5 Tips for Getting Pregnant with PCOS. And if you look in your blogs in your Premom app, it's the very first blog under the new blogs.
Awesome.
Check it out.
All right. Can you develop PCOS at any age? Well, it tends to happen like it happened with me. Again, maybe I got it earlier than I thought, but I was on the pill, so it was masked. But you do tend to get it when you're in reproductive age. Like, you're not all of a sudden going to develop it at 42. Nobody knows exactly why we do develop it. There are thoughts that it might be genetic, but I will tell you, every single woman in my family, my sisters, my daughters, my mother, aunts, nobody has heard of this. Nobody around me has had this, thankfully. I was really glad when I had daughters and I saw that they had it was like, you have regular periods? I'm so happy for you, because they don't know what I struggle with. Oh, well, they do know, but I mean, they don't know what it felt like. So usually you get it when you're starting out at reproductive age. You'll probably notice it then. Can having sex too much cause infertility? Oh, I like these questions. Nope. That's it. No, cannot. So have all the sex you want. You got anything there, Tara, that you want to throw in? Get some live questions into? Okay, go ahead.
Let's start with one from chat. It says, I have PCOS. My gynecologist doesn't want to check my progesterone level after I suffered 3 miscarriages. So I started using over-the-counter progesterone cream. Will that help me?
I didn't know there was over-the-counter progesterone cream. Usually that stuff is prescription. All right. So if you don't need progesterone and you take progesterone, it won't hurt you. You probably just wasted some money and your time using it. Miscarriages can be for a whole lot of reasons. They can be from a progesterone issue, but there's a couple of ways or would be clues into you having progesterone issues. If you find in your luteal phase, the time from ovulation to your period, if you find you spot, not implantation spotting, but off and on I spot a lot, like the week before my period or something, that can be a sign that you might have a progesterone issue. If your luteal phase is short, meaning less than 10 days, so from ovulation to your period should be more than 10 days, you need that amount of time to implant the embryo. If it's short, that usually points to a progesterone problem. It's an easy blood test that can be done about a week after you ovulate to see if your progesterone level is high enough. Usually PCOS shouldn't have anything to do with that. But yeah, I really can't answer about over-the-counter progesterone creams just because I'm only familiar with the real prescription strength progesterone.
Let's do some Q&A. We have one who says, I'm concerned about exercising impacting fertility. I see LH is low and suddenly peaks. Please, how can I know if I need to reduce my training routine?
You don't. There's the short answer. If you're used to it, any kind of exercise, working out, training, walking, whatever it is you do, if it's part of your regular routine, please don't stop it. I promise it does not impact your fertility. As a matter of fact, I'd be more worried if you stopped something that was good for you, because we all know training and exercising like releases endorphins, which is our feel-good hormones. And that's a really positive thing. So I think your body likes it, and it keeps you, obviously, it keeps you healthy, but just mentally and stress levels. So I always say, don't pick this time to conceive. Don't pick this time to go, I need to lose 50 pounds. I'm going to go on a starvation diet and join a boot camp. Okay, now you're throwing your body into turmoil, and I don't know that it's going to want to get pregnant during this time period. So don't do that kind of stuff. But when you're used to that kind of stuff, absolutely keep it up. I promise you it is not reducing your fertility at all.
And also, it sounds like you have a rapid onset, possibly, which is perfectly normal. Almost 50% of women, I think it's almost 50-50. A little more have gradual, according to this study that we found. But nearly half of women have that surge where you surge and peak in 1 day or less. So that's perfectly normal.
Absolutely.
Yeah, I have another one I have PCOS, first time tracking BBT on my second round of Clomid. Today I'm 8 days past ovulation and BBT rose from 98.29 to 98.45 this morning. Is that a good sign?
Well, I'll assume the BBT went up after ovulation. Usually BBT goes up a couple of days after ovulation. Sounds like you ovulated on the Clomid. Congratulations. 8 days DPO. So usually implantation will happen around 6 to 9 DPO. So you're probably right in that time period. Again, BBT should be higher after ovulation than it was before ovulation. I don't much care what the numbers are. Some of us run warm, some of us run cold. It's all relative, relative to your temps before ovulation, your temps after should be higher. And again, they're going to zigzag and go up and down, depending on how you're feeling, exactly what time you took your temperature. So that'll vary a little bit. So don't pay too much attention to the zigzagging as long as it's staying up.
Want another one?
Yeah.
How about two more?
Go, girl.
Two more, and then we'll jump back to some advanced questions. How long after the LH peak or the ovulation pain that usually takes about 4 hours, am I still in the fertile window?
Okay, so fertile window is actually the time before you ovulate. The best days, I call them the magic days. The two best days to have intercourse would be the day you peak and the day after you peak, because that's the day you release your egg. Those are the two best days. Now, because an egg can live itself up to 24 hours, there's something to be said about the day after ovulation being a good day for sex. But when we discuss the fertile window, that's actually like the 5 days leading up to ovulation. And the reason we call that a fertile window is because sperm live for up to 5 days in your body. So you can, if you will, preload your body with sperm so that when the egg finally does come down, there could be just a bunch of sperm sitting there waiting for that egg. So that's the fertile window. Ideally, we're not psychic. That's the whole reason you're doing the LH test, is you're trying to figure out exactly when you ovulate. But for you gals who are fairly regular, you can kind of guesstimate when you're going to ovulate, because usually most folks know when their next period is coming, plus or minus a couple of days. So if you say, yeah, I know my period I'm expecting it around September 25th. Well, roughly 11 to 14 days prior to that date is when you're going to ovulate. That's just cheating and so now you kind of know when your fertile window is. Not to mention, when you look at your chart, you know how you see those purple shaded in columns? Okay, this is a really confusing point to a lot of gals out there. I get this question every day, numerous times a day. The app said I should have ovulated and I didn't. It's like, why do you think the app said you should have? Because they're looking at the purple columns. That is just the app thinking that's when you will ovulate because somewhere down the road, you told the app how long your periods are. So it's guesstimating. It's like just trying to show you where we think the fertile window might be and we think ovulation might be here. Again, pay it no mind if that is not when your ovulation is. You didn't fail anything. You weren't supposed to ovulate then. That's just the app trying to be nice, trying to suggest to you, but that's all it is. But again, you can kind of use that purple shaded area to give you a guesstimate, because remember, I want you to start having sex before you get the peak. So that's how I want you to handle your fertile window.
Yeah, it's commonly challenging when you first start using the app to get a feel for how the app works and the ovulation prediction, because as Nurse Linda said, sometimes you're guessing about when your cycle is, and that's the information the app starts with. And then the app is starting with the average like luteal phase, but every person is different. So again, the app is still guessing. So once you actually start using ovulation tests, then the app is able to accurately predict your precise ovulation day. And even then, our cycles vary, right? So
Absolutely.
You might be like, this is when I'm gonna ovulate, but then you're a little stressed or whatever happens in your cycle, and it varies, but like my cycles vary a little bit from month to month. And so then you think you're supposed to be ovulating on a certain day, and so does the app. But again, it might be a little bit later or earlier. So keep using those ovulation tests. If you're doing BBT, that's a great method as well.
Yep. And in those first month, at least, when using the app, everybody's got a number. Like maybe you ovulate regularly when the number hits, I don't know, 1.2. Well, let's say you get a 1.0 and the app says, oh yeah, that means your colors, you peaked. And then the next day you get 1.2. So it goes, oh, erase. That wasn't a peak. This is the peak. But next month it will know, all right, I got Terry's number. She hits 1, then she'll hit something higher than that. That's how she does it. So the next month, the app is even smarter. That's why this is an intelligent app. So it really is learning. So the more you test, the better. And let me clarify, when I say the more, I mean starting it after a period ends, at least in the beginning. Testing daily, afternoon, evening. Some people get away with mornings, but I do prefer afternoons. And testing twice a day is fine, but honestly, don't waste the LH test strips by doing it more than twice a day. You're just going to confuse the app, waste your time. I'm OCD too, so I would probably do that, and I would need somebody to walk me off the ledge about it. But really, just twice a day is more than enough. And again, it's learning from you.
Yeah, and especially since this is an important topic for us. I'm going to hit on again, especially since we're talking about PCOS here. Like for many women who have PCOS, they tend to get the multiple surges. So it is really, really important to make sure that you've tested long enough to see your levels drop and stay dropped. And we highly recommend BBT in particular for those who have PCOS, so that you can confirm that progesterone rise that Nurse Linda has talked about. So even if you get that peak and you think, oh, I'm done, if your BBT stays low, then you're like, okay, I need to keep testing.
Exactly. So. And to clarify, when we say when you're PCOS, you don't per se get multiple surges, but you get multiple highs. Okay, you only have one LH surge in a cycle. So when you're ovulating, your LH only surges one time. But what happens frequently is gals get a lot of highs, bunch of lows, then they'll start peppering in some highs. And I literally will get that. I've had multiple surges this cycle. I don't know which one I ovulate. You didn't ovulate on any of them. They're just highs. You're just running kind of high. That's all right. I don't care about the lows and the highs. I really don't. I care about when you get peak, because that tells me when you're ovulating. So especially when you're PCOS, Terry's right. You're going to get a lot of highs. I know high sounds like it should mean surge, but it doesn't. High means it's higher than low. A surge.
Yeah, I should say peaks. Some women get multiple peaks.
Yeah, you will. And again, I hate to use that word because you don't actually get the word peak multiple times. You'll get multiple highs, and they will look like peaks on your chart, but you only get one real peak. So like Terry said, even if you get a bunch of highs, keep testing. we have inherently higher PCOS growth. We have higher LH levels than most gals. That's why that happens. There's a reason. We just have higher LH levels. Did you have another one there, Tara, before I?
Yeah, let's do one more. Does certain medical cannabis cause lower sperm count? And also asking about antidepressants like Prozac with sperm count.
So cannabis, that's what you asked about, right? Like medical marijuana?
Yes.
So
Cannabis
yeah, you know, there's a lot out there that says marijuana can impact sperm. Like anything, right? It depends on the frequency of the use, et cetera. But if you have a male partner who does regularly use marijuana, I know if it were me, I would probably want to get him checked out just to make sure I don't need to tell him to stop if he doesn't need to. If his sperm is fine, then continue. But if it does look like his count or motility are a little low, then we might want to take a break from the marijuana just to see if it doesn't help. As for antidepressants, again, antidepressants in themselves shouldn't be causing fertility issues. I always stress this with women too. Women try to come off all their medication before they get pregnant. Don't come off antidepressants. That's like real medication. Just make sure you're on the ones that are safe for pregnancy. There are plenty that are safe for pregnancy, but don't come off it. I always think of antidepressants as like high blood pressure medicine or something. You can't just come off stuff. You know, you're on it for your well-being. So don't, and again, with men, they need to stay on it as well. And no, it shouldn't be doing anything to impact their fertility in any big way.
Okay, I'm gonna grab some more advanced questions.
Okay, let's see what we got in advance. Do I have PCOS if I have cysts on my ovary? So yeah, it's not really a misnomer, but it is kind of. So this syndrome is called Polycystic Ovarian Syndrome. That means there are multiple, quote, cysts, but not really. What there are multiple follicles. What's the difference between a follicle and a cyst? Not really much. They're a fluid-filled sac. A follicle happens to have an egg in it. But again, a generic term for that would be cyst, because cyst is something like a sac filled with fluid. Cystic acne is that too. So it's just a fluid-filled sac. What happens is when you have PCOS, because your hormones don't go up and down like they're supposed to and cycle correctly, you may kind of have a half-assed attempt at ovulating. So you grow all these little baby follicles, and then they just sit there half grown. And then another one comes along and grows. So your ovaries are sitting there with all kind of follicles ready to go. When you go to ovulate, in general, you still will only ovulate one of them. But if you're hit with fertility drugs, that's when like everybody jumps ship and all the follicles ovulate at once. That's why it can be risky when you're doing IUI or IVF when you are PCOS. So no, it's not like when you hear a gal say, oh, I had a big cyst, it was so painful and it popped. And now you think, oh, you and I have a ton of those. Nah, it's just that we have a bunch of baby follicles. They call it polycystic, but that's what it is. Okay, I'm worried about my 64 plus day cycle. I had a miscarriage and I was positive for 6 days, then I lost my pregnancy line. Okay, so yeah, I'm so sorry you had a miscarriage. That is just devastating, especially after struggling. I know when I had my miscarriage, I thought I got pregnant with my miracle baby and then I miscarried. It's just cruel sometimes. It is Mother Nature, I know, but so unfortunately, yeah, if you're positive, starts coming up negative, then it sounds like you probably lost the pregnancy, though I would encourage a blood draw at a doctor just to make sure to watch those numbers. But yeah, I'm sorry about that. You know, the worst, and again, people ask, I'm sure somewhere in here I have this question, do people with PCOS tend to miscarry more often? And the answer to that is no. PCOS has nothing to do with miscarriage. So no. Our eggs are perfectly fine. Yeah, there it is right there. Do women with PCOS have higher rates of miscarriage? No. What tests do doctors usually perform to diagnose PCOS? My doctor said I don't have PCOS based on a blood test, not ultrasound. So, okay. I'm going to say there's 3 levels of testing, so to speak. One is literally how you look. Most of us look like me. A little bit chubby, extra hair everywhere. Thank you. Can tend to be more prone to acne. We have higher testosterone. So sometimes we have a look to us. The second way is blood tests. When you get your day 3 labs done, like FSH, LH, and estradiol, most often women who don't have PCOS, their FSH will always tend to be higher than their LH. Maybe your FSH is 7 and your LH is 4, that's normal. But when you're PCOS, it's the opposite. Your FSH may be 5 and your LH is 8. So that's usually a sign that you're PCOS, is you have a flipped ratio between your FSH and LH. You also tend to have higher testosterone levels, higher androstenedione levels. These are male androgens. So again, with blood tests, we tend to have higher levels. And then lastly is the ultrasound. If you do an ultrasound on a gal who's got PCOS, you'll tend to see all those little baby follicles sitting there. They call it a string of pearls because it looks like one pearl after another because it's just follicle after follicle after follicle on your ovary. So those are the 3 big ways of diagnosing PCOS.
I could be a blog.
There you go, right?
That's useful info.
Right.
Yeah.
With PCOS, what is the best way to tell when you are ovulating? Yeah, it's rough. The problem is how long are your cycles? Your way to find out if you're ovulating is the same as it is for everybody. You do the LH test strips and you wait for it to say peak and you're ovulating the next day. Do BBT at the same time and you'll see the temperature go up. That'll confirm ovulation. That's how to tell if you've ovulated. So PCOS is no different, except what if you're like that other gal and you have a 64-day cycle? When exactly? And by the way, that's not like it's always reliably 60 days. One time it'll be 45 days, then it'll be 90 days, then it'll be 60 days. That's how I worked at least. So what do you want me to spend my whole life doing LH tests? Well, yeah, if you want to get pregnant, that's basically what you do have to do. Maybe I'm not going to be the gal who starts right after my period ends, if I get one, because I'll be testing forever. I might wait until I'm on cycle day 20 because I know I'm not ovulating before then, because I know my periods are never shorter than 35 days. So I might try to be strategic, but otherwise, yeah, that is our destiny in life. It's going to be harder for us to get pregnant just because of the nature of how we ovulate. Does that make sense? Right? Okay. The more I read about PCOS, I feel like I have it. Is it only diagnosed by a doctor? Well, not necessarily. Remember that first way of diagnosing it, but that's just, kind of a lame way. But yeah, if you're not having periods and you look like me, and then it's a good chance you do have PCOS. But it is good to confirm it with an ultrasound or blood test, and generally you do need a doctor for those things. Why does everyone tell me to lose weight to resolve PCOS? I know, right? We hate hearing that. I don't want to hear that. Even if it's the right information, I'm here to tell you, not with everybody, of course, it was the right information for me. And when you have, and again, I don't know what came first, the chicken or the egg, right? But when you have more fat cells, they tend to convert estrogen into male hormones. So there's something to be said about when you lose weight and you don't have as much fat in your body, that you're not going to convert your estrogen to male hormones and have these issues. Like I said, I'm just telling you what absolutely did make a difference for me was, one, losing weight. And again, I got pregnant 4 times in my life. Now, my kids, all 3 of them, are all like 10 years apart. That's PCOS for you. Remember, I said it wasn't easy. There you go. It's not easy. But I did get pregnant 4 times. I have 3 living children. And then when I got older, it got easier because somehow our hormones calm down a little bit as we get older, right? But yeah, I know. How do we lose weight? What's a good diet for PCOS? Don't go like nuts with like low carb, keto kind of thing, though you do want to focus on good carb because, of course, right now we're only discussing the fertility side of PCOS, there's a whole metabolic side of PCOS as well. We tend to be insulin resistant, which means that we have insulin in our body, but our cells are resistant to take it in. So we tend to have higher blood sugars. We tend to have hypertension, high blood pressure. So we have there's a metabolic component. So keeping our weight down, eating good carbs, high fiber stuff, eating the rainbow of fruits and vegetables, that's the whole, you can read about that, but yeah, it's not like going on keto helps. I will tell you personally, I do intermittent fasting because that works for me. And it at least helps me maintain my weight. So intermittent fasting means that you're not eating for 12 to 16 hours. Of course, I'm counting 8 hours of when I'm sleeping as part of that too, but that does tend to help me as well. Oh, here's a good question, Terry, you brought this up. How do I know if I've peaked when I have multiple surges from PCOS? Well, like I said, there is something called an LH surge. That's what the app calls peak. So you don't have multiple surges. What you have is you keep spiking up with all these highs because we have a higher LH level. The best thing I can tell you is ignore that. Just keep doing your LH because eventually, regardless of how high you run, you will surge LH to ovulate. You have to. So you have to keep doing the LH test. Just ignore the fact that you have all these funky little highs all over. That's the nature of being PCOS. You will only have one true surge and one true peak, though, and the app will tell you that.
I look for the last highest result of whatever you got going on there. It's the last one. The highest one. The highest one.
What's the best tip to get pregnant fast with PCOS? Probably go to a doctor because, again, depending on what your PCOS is like, for me, it took I told you, my kids are all 10 years apart for that very reason. If I were more aggressive and I went to docs to get on medication or pursued Letrozole or something, I might have gotten pregnant faster. That's true. So yeah, if you really want to get pregnant fast, there's nothing we can do to really make you have periods any more regular. Again, unless you're like me and losing weight helps, but that takes time too. And that's really hard. But yeah, you can see a doc and a doc can help you with that by putting you on oral medications. Are there any successful ways to get pregnant with PCOS? Yeah. What I just mentioned, going to a doc or losing weight and again, remember, even if you're ovulating irregular, you're ovulating beautiful eggs. You can get pregnant, but you got to really stick to that LH testing. You got some, Tara? You want me to answer?
Oh, it sounds like I'm echoing. I did have one kind of related to what you're talking about, and I did want to plug that blog again that we just released about getting pregnant with PCOS. Because we have a question. I have non-insulin resistant PCOS, and I am so confused as to what I can do for my health, fertility, and my short cycle, 21 to 24 days.
So that's probably, you've got this, what they call the skinny PCOS. I wouldn't know anything about that. I'm the chubby PCOS. But yeah, there are adrenal-based reasons. That adrenal gland is an endocrine gland that's on top of your kidneys. And sometimes it fools around with your hormones too. But so I'm sorry, Tara, give me that question again, what the specific question was. I know she has short cycles.
I have non-insulin resistant PCOS, and I'm confused what I can do for my health, fertility, and short cycles, 21 to 24 days.
Right. Well, in itself, I'm not worried about 21 to 24 day cycles unless you tell me the luteal phase, the time from ovulation till your period, is less than 10 days. If that is the case for anybody who's got a short luteal phase like that, you're going to want to get to a doctor to get placed on progesterone or some medication that stretches those out for you. Progesterone will do it. It's easily remedied. But if you tell me, no, my luteal phase is always 11 or 12 days, then that's fine. I don't care how short your cycles are. As for your general health, again, because you are not insulin resistant, you don't have the same metabolic issues that I have. But I don't know if there's any other general health issues that it is reflecting. So I guess I probably am going to say I'm not an expert on that, so I won't comment on that. That's probably better to have your doc talk about that.
I actually have short cycles. I have a 24-day cycle, but I tend to ovulate on the 12th or 13th. So yeah, I just make it in that acceptable luteal phase length.
And that's good enough.
Let's see, I have some more here. Someone said, how good is 29%? I think she would say body fat.
I think, don't ask me. I don't know, I'm somewhere in the 30s. I think Tara, do you know what the ideal body fat is? It's in the 20s. I want to say it's like,
yeah, it was in the 20s.
Yeah. Again, I mean, when it comes to body weight and PCOS, everybody's different. I mean, there are girls that much heavier than me, and they were still ovulating with PCOS. So everybody is different. But I will say, if you have PCOS and you are chubby like me, you might want to, like, this is easy to do, but lose a little bit of weight and just see if it makes a difference. It made the difference to me to conceive or not. That's how much of a difference it made for me. But then, of course, I would just get fat again after I got pregnant. It would take 10 more years. That's how long it takes me to lose weight. So I'm waiting still on my 14-year-old's weight to be lost. So yeah, but 29% is fine with me. But again, if you find that your ovulation is irregular, losing a little bit of weight might help with that. I hated hearing that, so I hate saying it, but I know it's true. What else you got, Tara?
We have, can you talk about failed implantation? For example, you conceive but don't implant. Are there signs of that?
Okay, well, so there's failed implantation in that nothing happens. I didn't implant at all. And then there's failed implantation, like I did, like chemical pregnancies, right? Like I implanted for like a minute, like I had positive tests and then my period was 2 days late and it came. That's an example of a chemical pregnancy. That's a miscarriage. It just happens so early on, they call it chemical. So failed implantation, generally the reason why you don't get pregnant every month of trying is because, and I know this is not a popular concept to hear, but probably half of your eggs are abnormal depending on your age. If you're in your 20s and early 30s, probably half are normal and half aren't. That's because your eggs are 20 and 30 years old, and that percentage gets worse as you get older. So that's why. I mean, I've got a 50-50 chance if I'm a young girl that the egg I'm ovulating this month is going to be normal. If it's not normal, I am most likely not going to implant. But of course, we all know somebody who's had a child with, Down syndrome or something. Those are abnormal eggs that did fertilize, did make an embryo, did implant, and delivered a baby 9 months later. Most of the time, you don't implant at all, or you implant for, a couple of weeks maybe, and then you lose the pregnancy. Most pregnancies are because the embryo wasn't normal, and the embryo wasn't normal 95% of the time because the egg wasn't normal. Sperm is only 2 or 3 months old at any point in time. So men can have babies till they're old. Of course they can. They don't have to carry them. They just have to ejaculate. But we have to carry a pregnancy. So there's a reason our body does what it does. It doesn't want an old lady like me having a baby. That would kill my body, literally. So it doesn't want old people to have babies. It's too hard on our bodies. So it makes our fertility very limited. But implantation is most often due to an abnormal egg. Every now and then, like seldom. But a woman could have an implantation dysfunction. Like if a gal tells me she can get pregnant, no problem. Every other month she can get pregnant, but she miscarries 4 or 5 times. Now we might say, well, come on, they can't all be abnormal. I mean, she is making embryos. Then I would say she might have an autoimmune issue that doesn't allow an embryo to implant. But that's called recurrent pregnancy loss, and that's something altogether different.
Can I do some more?
Yeah, please.
My 17-year-old niece has recently been diagnosed with PCOS. She doesn't know. Mom hasn't told her yet. Any advice for mom on how to support or explain? She's worried the news will crush her dreams of being a mom someday.
Oh my gosh. Yeah, no, don't break her heart. I mean, somebody could have told me, I guess, at 17 that I was going to be PCOS, but I wouldn't have understood. You know, most women in their 30s don't understand how ovulation and hormones work. I mean, nobody explains this to us. I always use the example. I got a car sitting out here. I don't know how it works, but I can drive it. So that's how my body is. Most of us don't know how our body works. So she's not going to understand things, you know, if she's got irregular periods right now. But again, PCOS is all kind of levels. I ended up having 3 kids in life. I don't know, that's probably what I dreamed about when I was 17 years old, and it worked out just fine. Well, it was a challenge, but I got my 3 kids. So I don't know that I would necessarily, unless it's impacting her right now, you're just going to scare her. And mom probably doesn't understand it. Heck, most of us don't understand it. Even docs don't always understand where it comes from or how we got it. So it's just going to be almost more confusing. I would say if it turns out, you know, she gets to a point where she wants to start thinking about getting pregnant or having kids, then I would make sure that, you know, see how her cycles are at that point, and then have a doctor explain it to her a little bit, have her do a little bit of research on it. But I probably wouldn't bring that out to a 17-year-old right now. It's not like I would hide it, but I mean, I just wouldn't necessarily bring it out. And remember, if you're not looking to conceive and you just don't want the side effects of PCOS, go on a birth control pill. I said, I was on a birth control pill for, I don't know, 5-7 years. And I didn't have any of the side effects of PCOS. I mean, I don't remember having all the hair issues and weight gain issues. That all happened when I came off the pill. Sadly, though, once that hair grows in, you got it for life. It is a B word. I hate it. So, and by the way, it gets markedly worse after menopause. So, oh yeah, you got something to look forward to. But yeah, you can do lasering and electrolysis while you're trying to conceive. That was actually one of my questions. That's no problem. It's nothing dangerous about that. So have at it. Electrolysis and laser are the permanent ways to remove unwanted hair. What else you got?
A few more, and then we'll switch back to any other ones. First of all, someone said, and someone said, thank you for answering and for the positivity. And it looks like they did a little emoji. Oh, that was cool.
I love you guys. Thank you.
Is 10 DPO too early to take a pregnancy test?
Oh, that's always a good one, isn't it? Yeah, if it's positive, it's perfect. The reality is most are not. And I'm saying if I take 100 pregnant women, they're pregnant. Most of them, more than 50%, will not test positive on 10 DPO. More will test positive on 12 DPO. And then there's going to be a handful that won't test positive until 14 DPO, like literally when Aunt Flo is late. But some do test positive on 8, 9, 10 DPO. And of course, God bless them, those gals get out there and they post about it. So would I, if that were me. But all those gals who get negatives that early, they don't tend to go out there and shout from the rooftops that they got a negative. So what you tend to read is, oh my gosh, everybody's getting their big fat positive at 10 DPO. No, just the gals who got a positive talk about it. The ones that didn't, don't. So you're getting a skewed view. So I know how impatient. I just did a blog and a video on the 2-week wait, the dreaded 2-week wait, as I call it. It's horrendous. I hear you. And we think, oh, I'm just going to do a pregnancy test. And God, please, I can't stand it anymore. I have to do it. And I know it might be negative. I'm fine with that. Yeah, you know what happens when it's negative? You freak out, as I would. And you're disappointed and you think the whole cycle's a bust and you just beat yourself up mentally. I really think it's a better idea to stay impatient a few extra days. That's my advice. But I get it. Y'all do what you want. I'll be there. I'll be there over and Ask an Expert when you want to come to me and talk about it. You do what works for you, but I'm just telling you with the majority of women how they suffer by doing it that early.
Okay, let's squeeze a couple more in. I'll answer this next one. And Premom is 0.69 a peak, or can it be? And the answer is yes, it can, but keep testing to make sure that's your last highest result. That's like my catchphrase. Make sure it's your last highest result, because some women do peak that low, but you might think you've peaked and you just haven't tested long enough. And then, as Nurse Linda talked about, you get a higher result later. That's your true peak. So long answer, short. Anyway, there it is. I have PCOS and had a suspected chemical pregnancy 2 months postpartum, but have not had a period since the bleeding after that. it has been 101 days since then. Is there any way to kickstart ovulation again? Sorry for your loss.
Oh, yeah. So you got double whammy there because after a miscarriage, the hormones of you were pregnant, and your hormones have got to cycle back to normal again. So you've got your body is trying to get back to normal. And then on top of that, your PCOS. Remember, that's like, I got pregnant after a miscarriage and I don't even think I had a D&C and I didn't even have a period. And like somewhere 6 weeks later, I don't know, I had sex and I apparently got pregnant and her name is Echo and she's 24 right now. So it happens. And so, but the short answer is no, I can bring on a period with Provera. And any of you PCOS girls, a lot of you know what Provera is. It's just an oral pill. You take it for 5 days, 7 days, 10 days. And when you stop taking it, it brings on a period. Well, it's a fake period. It's not a real period. It's a bleed, but I mean, it's fake in the sense that it wasn't brought on by hormones like a period is supposed to. It was brought on because you took progesterone for 5 days and then stopped taking it. And that act of stopping progesterone is what brings on a bleed. Just like in real life, when you don't get pregnant and your body goes, oh, shut off the progesterone factory, she's not pregnant, you get a bleed. Or you stop taking your active birth control pill. A couple of days later, you get a bleed. So I can tell you how to bring on a period, but a period is not the same as ovulation. Your body will ovulate when it wants to, or when you go to a doctor to get prescribed medication like Letrozole to ovulate. Like I said, my ovulation was very weight dependent. When my body lost some fat, ovulation came back a little bit better. That is not an easy answer, and most certainly is not a quick answer. So the only way to do it quickly is to see a doctor about medication. But like I said, you're coming off, postpartum, you're coming off a miscarriage. You got a lot going on. But 3 months, if I'm right, Terry, you said it's been 3 months since she's ovulated. That's a long time.
I think it was 100 days. Yeah.
Yeah. So now, even if you don't want to get pregnant, you should have a period like every quarter. So again, you can go to a doctor, they can give you Provera, that'll cause you to bleed, just to kind of clean out your uterus. It doesn't cause you to get pregnant. It doesn't help you get pregnant. It's just progesterone to bring on a bleed. Bringing on ovulation is a whole different set of medications like Letrozole or Clomid.
Do we have any other advanced PCOS questions that we still need to cover?
A
lot of them.
Yeah. I've had 2 chemical pregnancies so far. Could this be due to PCOS? I am sorry. Those miscarriages are brutal. You know what? Sometimes, never mind the obvious reason they're so brutal, is because we lost a pregnancy, but they really taint you for your next pregnancy. Like, how can you enjoy your next pregnancy when you're so afraid? Well, do me a favor. Don't be. Okay, this is a new baby. This new baby deserves as much of your positive energy and vibes as it can get. Enjoy every minute that you are with a baby. I don't know what's going to happen. I don't know that I'm not going to get hit by a school bus when I leave here. I don't know. None of us know anything. So who knows what's going to happen? Just let that go. Let go of it and just enjoy it while that baby is there. And hopefully that baby stays for 9 months. But so try not to let it do that to you. We do that to ourselves, So try not to do that. But no, PCOS has nothing to do with chemical pregnancies. It's just a coincidence. Like I said, chemical pregnancies are usually due to eggs. How high does I'll let you do this one, Tara. How high does my LH peak need to be to get pregnant?
It varies. So I can tell you a little bit about the app. So on a basic level, your typical ovulation test goes on the average of 25 MIU/mL. If you're using a quantitative Premom test, you can watch for a 25 level or higher. If you are using like a typical test that uses the test to control line ratio, you're looking for 1.0 or higher. But some women have peaked and gotten pregnant as low as like a 0.5, which is half of that, which I guess would be like 12 12.5 theoretically. Same thing on quantitative tests. They've peaked as low as like 12 or 12.5. So that's why I just keep reiterating that you need to make sure you found your last highest test, but that last highest test could be as low as 12.5. Some women get as high as 80. So that's why Nurse Linda is like, don't get too stressed about the numbers. It does vary. And if you're lower than 12.5, though, I think that's really pushing it. And not too many women are at 0.5. It tends to be 0.8 or higher. A lot of peaks I've seen have been between 1.0 and like 2.5, but I've seen as high as 3.5. So again, kind of keep that in mind, that 25 or that 1.0, but that's an average. That's like a marker to kind of gauge by. I love talking about that. Thank you for giving me that one.
Yeah, well, I have one huge deficit here. I can't do ovulation tests. Oh, lady. Done. Shop is closed. So I can't use the app. I can't, when my daughter was using it, I was like all over up in her grill trying to learn what she did and what she found out and what her numbers were, because I learned through you guys, because I can't actually use the app. So that's why I defer to Terry, somebody who's actually used the app before. Somebody mentions that they were on myo-inositol and it made them ovulate. And once they conceived, they have to stop taking it. That's awesome. I mentioned earlier that, yes, sometimes these supplements, inositol is an over-the-counter supplement, or you get it from Amazon or any of those places. Metformin is a prescription medication, but sometimes these oral medications that try to help balance things out in our body do work, and they can help. So, and again, metformin can have some GI side effects. It's not always agreeable with everybody. I took it. I didn't have any problem with it, but I'm not sensitive to GI stuff. Inositol I still take, and it doesn't bother me at all. But you can take it while you're trying to, or once you conceive. It isn't anything that's dangerous or risky at all. So yeah, I'm glad it worked for you though.
You want to take one more? 7:50.
Sure, go ahead. Go right ahead. Okay. Oh gosh, our hour's almost up.
I know, it flew.
Ow, shoot. Time flies. Go ahead.
Okay, I'll take this last one here in order, and then we'll wrap up. I have a friend who's postpartum, gave birth in May. She's losing hair in small to medium amounts since birth. Is this normal?
It is. And you know what? I found that out the hard way. Oh. So what happens is I have a ton of hair. And so, like in any typical shower, I'm always losing handfuls of hair. I got plenty. But I noticed when I was pregnant that I wasn't losing as much hair. And so, of course, we all do hear about how after, when you're postpartum, you just lose all kinds of hair. Well, it's not because you're truly losing hair. It's because you held on to hair while you were pregnant, and now you're losing all of it. Hair cycles. So, you were supposed to lose some hair on the regular. But yeah, that's what happens after postpartum. Generally, that's it. Now, certainly, if it's something beyond, like she's actually seeing bald spots or something, that's a little bit different, and you got to follow up with your doc to make sure there's no other hormonal imbalances. But just in general, I absolutely did lose a lot of hair. I didn't notice it oh, my ponytail's so much thinner now. Not like that, but I when you shower and brush your hair, you're like, dang, the brush is filled with hair, which is how it always is for me. What else is that? I think that's it.
Make sure you check out the chat. Nurse Linda, you got some nice compliments here.
Oh, I love you guys. You know that. I do this because I love doing it. So, it's a work of love. I appreciate you guys. You guys give me a lot of good feedback. I know I might not always be everybody's cup of tea, but I am real and I am honest, and I will always tell you the truth, and you'll always know what I'm thinking. So I appreciate you guys. What else?
You have some great questions. I just want to thank you for your great questions. Every week has been interesting.
So darn smart.
I know. I'm like, wow, I learned something else new today. Just from your great questions.
Yeah. You are a cup of tea. Oh.
Oh.
Thank you.
Yeah. You make our day. Really, you're wonderful, all of you.
Yeah.
So we're here on Thursdays. Come back next week if you can. And we also have the recording. We'll be putting that out hopefully within the next couple days. And you can always find Nurse Linda and ask an expert, and she'll get back to you in a jiffy.
Absolutely. Absolutely. Thank you guys all for coming. I appreciate it. I appreciate seeing you guys and talking with you guys. And I really do feel like I'm talking with you. It's like I can see all of you out there, and I really appreciate you. And I hope this is helpful for you, because I sure wish I had this help when I was your age doing this. So appreciate you guys being here. And until next week.